Let's talk a little bit about our conventional TKA. So I'm a user of 3 different robots. So that's my conflict of interest. We deal with a great spectrum of patients, ranging from younger or middle-aged patients who have story of a knee pain and who cannot jog or walk anymore. And we have patients like Hina Bain, who may have suffered for the last 10 years with knee pain, but does not want to get a knee replacement done. When things become difficult, they come to us, and as surgeons, we think whether we want a robotic TKA or a conventional TKA. Definitely the robotic papers talk all about accuracy, and you heard it all in the previous presentation that it is so very accurate. But is accuracy equivalent to a happy outcome? All these papers would suggest so, that yes, do a robotic TKA and your patients are going to be absolutely happy. Guess what? There is one thing in common in all these papers. All these papers are from an institute who have got the robots, who have bought the robots. So they have invested. And then we have long literature from our experience of the surgical colleagues who talk about Da Vinci and all other robots and what all has happened over the past. We have few unbiased Cochrane-based publications which talk about the complications and downsides of the robotic knee replacement. Definitely, there is a higher initial cost. With CT-based robots, there is a radiation exposure and there is limited implant option. So it's like an unhappy marriage where you might like the robot, you might like the technology, but you have to use that one particular implant. We know so many surgeons across Mumbai who have been practicing for the last 20 years using a particular implant. Just because they have bought a new robot, they have now shifted their allegiance to the other implant because that robot will allow only that one particular implant to be used. There are some other studies which suggest that definitely in us in the initial stage right now, the robotic TKA will take much more time, which can translate to much more chances of infection. And of course, it's a costlier procedure worldwide. People invested in robots thinking that, okay, this will give me a big marketing platform. I will have an early mover advantage. Guess what? There are 4 robots in Navi Mumbai right now. So this early mover advantage for robots is no more. Think about the return of investment if you're thinking from financial perspective. Because of the cost involved in buying that particular robot, even outdated robots over a period of time are going to continue. Why? Because the institute or the surgeon has invested in it. What about the maintenance? Almost 5 to 10% of AMC, CMC costs. Where does that money come from? Obviously from our patients. So, of course, abroad, there is the difference between a conventional and a robotic TKA. The difference might be even to the tune of 2 lakh Indian rupees. Now, we might say that 2 lakh mein to main knee replacement karke de deta hu. That is the difference between the two technologies in most countries. Few papers which have come out now, which are from good journals, and they suggest that in terms of revision and complication, there has been no difference in robotic or conventional TKA. So what is the impact? What are we observing in more and more institutes, especially in US, where there are some surgeons who are using exclusive robots? So residents are now becoming more and more uncomfortable if they were to perform a conventional TKA. So there are centers across the world who do exclusive robotic, and it's a study. It has been published in Journal of Arthroplasty. It's a reputed journal. There's a 2023 article that a resident is saying, no, I cannot do a conventional TKA anymore. So are we descaling our younger surgeons who are coming that, okay, that this surgeon can do it only with the help of a robot? So imagine yourself, you are in the OT, you are a younger surgeon and you are trained a robotic surgeon and the robot starts working. There's a technical error. The company person says, sir, some error is there, I'm not able to know, it will take some time to know. So are you going to stop your surgery there just because you're not skilled enough to do a good conventional TKR? Let's talk about an old experienced surgeon who has got a massive practice, 1,000 joints in a year. Now he's already very happy doing a conventional TKR and he takes hardly 35 to 45 minutes to do a TKR. And let's talk about a young, less experienced surgeon who is just budding in his practice right now. You want the young, less experienced surgeon to be good at conventional TKR because you're sure that, okay, this is something he should know. And the old surgeon who is experienced, who is doing massive numbers, he says, I'm already doing so well with my conventional. Why should I adopt to a new technology which will take more time of mine and maybe it will give me as good results or maybe not as much? I'm already happy with my results. So it does not appeal to both of the patient groups, the old experienced surgeon as well as the young, less experienced ones. Look at this article. Now this is the article which is most talked about and my colleague talked about the same, that 15 to 20, even 25% dissatisfaction rates after TKR. Now remember, the article clearly mentions that all these TKRs had completely normal, perfectly executed X-rays. If you look at the X-rays, it was well done. If you look at the operative notes, it was well balanced, which means that the surgeon has given his best to do this knee replacement. Despite that, 15 to 20% patients are dissatisfied. What is Robotic trying to achieve? We are trying to achieve an accurate alignment, good positioning of the implant and good ligament balancing. So same thing Robotic is trying to achieve, which has already been achieved by these surgeons. So why do we think that it is going to settle this problem of dissatisfaction of the patients, where it is going to solve only the same thing, alignment and balancing? It's not doing anything different to satisfy the dissatisfaction. So are we barking the wrong tree over here? When ChatGPT was launched as an AI platform, we all were very excited about artificial intelligence, but it was launched as a research platform. It has been given out as free for use, that people use it, they are going to mature over a period of time, and of course they are going to have paid versions over a period of time. So this was AI. But when it came to robot, similarly when you look at the hip replacement, when it was invented, it was tried and tested over so many hips. There were Chanley 500 hips where he tested this and then it was gradually came out of the market. But when we talk about the robot, it has been sold by the companies at a premium price. It has not been given free to the surgeons. Come on, use it, see if it is helping you in your surgery, see if it is reducing your outliers. There is a big investment involved and that is the main conflict of interest, because your practice, your opinion is going to be biased once you buy the robot that yes, robotic knee replacement is the best surgery. So nothing against the technology. Yes, we should update ourselves. We don't want to stick to the past. We want to look forward. We want to get better and better. But let us get the best technology at an affordable price to be using it. So this is a tug of war between technology, innovation and accuracy, but something which is time tested, which has been immensely successful and which has been very, very affordable. Look at all the literature which talks about robotic and the success. It will say may favorably influence clinical and radiological outcomes, may lead to marginally better clinical outcomes than conventional TKR. Is this the success that we are looking at? It's his birthday today, and I would just quote him here, that we want to make it open, make in India, not sticking to one implant, affordable, a mature technology. Maybe there is a role in UKA where you require as much precision to do the surgery. What is the theme of this conference? Orthopedics, ethical and affordable. I don't have to add it over here. Our robotics making it ethical and affordable. Thank you so much.